Yesterday we have discussed different movements. Like yesterday we have discussed flexion, extension, and the different movements, right? तो कल हमने अलग अलग प्रकार की मूवमेंट्स की बात की थी, एक्सिस के अकॉर्डिंगली, राइट। आज हम उसे कुछ एक्यूपंक्चर पॉइंट के साथ ऐड करें। सो टुडे वी विल बी डूइंग द discussion of anatomical part, as well as we will be adding with our acupuncture points, right? Give me 1 minute, sir. So let's start. So whenever we are talking about the movement is happening by the muscles. Suppose I want to lift my eyes, I want to squeeze the eyes, lift the eye, open the eyes. So this movement is happening by the group of muscles. I want to open my palm, I want to close my palm. So this movement is happening with a group of muscles, right? Sometimes we are not able to do the movement. We are not able to open the eyes or the drooping of the eyes. We are not able to open the finger, or we are not able to close the finger. We are not able to keep the spine erect, or spine is dropping down. Then how can we correct our alignment using the acupuncture point? तो अब हम बात करने वाले हैं कि कई बार क्या होता है कि हमारे शरीर में कुछ ऐसी विकृति आती है, जैसे हम उंगलियों को बंद नहीं कर पाते, उंगलियों को खोल नहीं पाते, हाथ को हम फ्लेक्स नहीं कर पाते, एक्सटेंड नहीं कर पाते, या स्पाइन को सीधा नहीं रख पाते, स्पाइन बेंड हो जाती है या ज्यादा बेंड हो जाए. We have acupuncture point for every movement, so we can tell them motor point or trigger point. Okay, so right now I am going to discuss a very small and the very few motor point, but with the time we will be discussing more and more. So let's start. Class is already in English and Hindi. Okay, I am also speaking English, also speaking Hindi, right? Both. So let's see now. So we will be discussing few motor points. Motor point connected with the movement, that's why we are discussing here. So first I will ask Dr. Nidhi explain the ptosis.
Yeah. So the ptosis means the drooping of the eye. ठीक है, तो आई हमारी जैसे ड्रूप हो जाती है, नॉर्मल पोजीशन में नहीं रहती. हमारी आई की जो अपर आईलिड्स है, ये वाली आईलिड्स, तो वो ड्रूप हो जाती है ड्यू टू द वीकनेस इन द मसल्स. सो ptosis means there is a weakness in the muscles which is not able to control the eye in a position, the upper eyelids. Okay, so the muscles which is responsible for this ptosis are levator, palpebrae, superior.
तो हमने देखा कि हमारे आंखों के ऊपर एक मसल पाई जाती है, ये मसल ऊपर, we can see here. The name of muscle is levator. The meaning of levator, who is like an elevator, who lift up. palpebral superiosis, who is lifting the eyelid up, जो हमारी eyelid को ऊपर की तरफ उठाए, एलिवेट करे, उसे एलिवेटर यानी लेवेटर कहते हैं, लेवेटर palpebral superiosis. Sometimes what happening, there are many diseases, like number one disease that is called aging. With the age, this muscle losing the power. Number two, diabetes also, this muscle losing the power. Number three, there is a disease that is called myasthenia gravis, or any disease where we are having severe muscle weakness, हमारी मसल का एकदम से कमजोर हो जाना और उसके पीछे की नर्व का कमजोर हो जाना, और जिसके कारण से हम आंखों की पलक को ऊपर नहीं उठा पाते, we are not able to lift the eyelid up. This is called sagging of upper eyelid. So drooping of eyelid or ptosis means sagging of upper eyelid, right? Or it is called ptosis. So I told you many causes. There is a weakness of the muscles that raises the eyelid. This is the cause number one. कारण नंबर पहला है कि उस मसल का कमजोर हो जाना जो आंखों को ऊपर उठाती है. So number one is muscle. The cause number two is nerve, damage of the nerve who controls this muscle. ये भी हो सकता है कि ये मसल तो ठीक है लेकिन इसके पीछे की नर्व गड़बड़ है. And number three, there are many diseases like because of the aging, because of the diabetes also people are suffering, right? Sometimes it might present with the birth. How can we treat it? हम इसे कैसे ठीक करेंगे? In the acupuncture, we are having very wonderful point that is called gallbladder 14, GB14. एक हमारा बहुत ही शानदार बिंदु है. इस बिंदु को हम कहते हैं gallbladder 14. You can see in this image. So we are stimulating the gallbladder 14, and there's a wonderful point who elevate the muscle, who give strengthening to this levator muscle. So when we are stimulating gallbladder 14, it is giving strength to the levator palpebral muscles. Not only this, it's also giving strength to our nerve, motor nerve, who is behind this muscle. जब हम gallbladder 14 को एक्टिवेट करते हैं, इस मसल को भी स्टिमुलेट करता है और इस मसल के पीछे हमारी जो नर्व है उसे भी स्टिमुलेट करता है. अब मैं आपको बताना चाहूंगा इस पॉइंट की एग्जैक्ट लोकेशन, सो दैट यू कैन परफॉर्म द ट्रीटमेंट वेरी नाइसली. So would like to tell you the location of this point. So this is the point, gallbladder 14. I will show you. Let's see. So from the midpoint of the eyebrows, if we are going near our one chin up, from the midpoint of the eyebrow, we are going one chin up, that is the location of gallbladder 14. Right? Wonderful point for ptosis or the drooping of eyelid. हम देखते हैं midline है हमारी, और midline से अगर हम बिल्कुल बीच में चले जाए, so when we are inserting the needle here, we are pulling the skin, squeezing the skin and put the needle. इस skin को हम squeeze करके यहाँ पर needle लगाते हैं. So this is the location of gallbladder 14, right? So now let's move to the point number 2. So now we are moving. Look at here. This is the ptosis. In the ptosis, what's happening? The person is not able to lift the eyes up. And this is the location of gallbladder 14 point. Wonderful. Now, we are moving to the next.
So, raises the mandible and close the jaw. So, हम तो जब हम खाना खाते हैं तो माउथ ओपन और क्लोज होता है, तो ये मूवमेंट है कि मैंडिबल है, ये मैंडिबल होता है, तो उस मैंडिबल ओपन एंड क्लोज, so closing of mouth open and close it done by the master's muscle.
तो ये हमारी मैसेटर मसल है, मैसेटर मसल, वी कैन सी हियर, चबाने वाली मसल, the masseter muscle, who is holding your mandible, who is holding your jaw. So you can see the movement of jaw here. आप यहां पर jaw की movement देख सकते हैं. So when the jaw is closing means mandible is up. आप देख सकते हैं कि mandible ऊपर आएगा तो जबड़ा बंद होगा, और mandible नीचे जाएगा तो जबड़ा खुलेगा. So when we are raising the mandible, it closes the jaw. Right? But sometimes what happens? This movement is getting disturbed. This movement is hindered. This movement is not possible. Person is not able to raise the mandible. हम बाद में बात कर लें. So in this way, who raises the mandible? How to raise the mandible and close the jaw? कई बार ऐसा होता है, एक हमारे पास पेशेंट आए, हमने उनको कहा कि जीभ दिखाओ. We want to do the tongue diagnosis. Open your mouth and show your tongue. It's the rule. You can ask the patient to open the mouth and show the tongue for only few seconds. If sometimes patient is not able to pull the tongue back, if you are keeping the tongue for longer duration, आपने कहा कि जीभ दिखाओ, और अगर आपने ज्यादा समय के लिए जीभ को बाहर निकाले रखा तो उसका मुंह बंद नहीं होता, not able to take the tongue in, right? In this condition, the wonderful point again who will close your jaw, that is stomach 6. Stomach 6. I would like to show you the location of stomach 6 in the next image. This point exactly over the your masseter muscle. आपकी जो masseter muscle होती है उसके ठीक ऊपर ये point पाया जाता है. So we can see here, this is the masseter muscle. In between the masseter muscle, stomach 6 is located. हमारी इस muscle के ऊपर पाया जाता है. Look at in the other image. You can see this is the location of stomach 6. So would like to show you the location in the other image. Let's see here. Stomach 6. So look at here. This point is located over the masseter muscle, and we are also stimulating this point for beautification, because many person eating tobacco, this muscle is coming out. जो लोग तंबाकू का सेवन करते हैं उनकी ये मसल बल्ज हो जाती है. तो हम इस मसल का मिड पॉइंट ढूंढकर इसमें पॉइंट लगाते हैं. We can put the point in any directions, or we can put the point in multiple directions as per the need, as per our target, right? हमारा stomach 6 है. Stomach 6 पर हम पॉइंट लगाते हैं. You can see in this image, stomach 6 point located exactly on the mid of the masseter muscle. Look at here. So this is the point who will help for closing the jaw, right? Closing the jaw. Many persons are sleeping in the night, keep open their mouth. This point will be helpful. So we can see here, this is the masseter muscle here. And this is located exactly in the center of this masseter muscle, right? Stomach 6. This point we are using in the cosmetic acupuncture because we know there's a treatment called Botox. So we can tell is acupuncture Botox. What is acupuncture Botox? We are putting the needle on the stomach 6 and sedating this point to reduce the hypertrophy of this muscle, because the beautiful face means be saved. अगर आपकी मसल बाहर निकल जाए तो बोलते हैं कि ये ब्यूटी के विपरीत माना जाता है. Okay. So remember one thing, this was the point. Again, remember, stomach 6 is the point. Number 1, it's a very good motor point. Who is helping? The closure of the jaw, जो हमारी jaw को close करने में हमारी मदद करता है. दूसरा ये बहुत ही शानदार पॉइंट है for beautification, for bringing the good shape of the face, stomach 6. Okay, start.
So rotate the head to the opposite side. Rotation of the head to the one side. Okay. So when you this is the rotation of the head to the opposite side. जब भी हमें opposite side पे head rotate करना होता है, उसके लिए ये point important. कभी कभी कुछ पेशेंट में ये प्रॉब्लम आती है कि ये वो अपना हेड यहाँ से कंट्रोल नहीं कर पाते और रोटेट नहीं कर पाते ड्यू टू सम पैथोलॉजी इन द मसल्स और इन द जॉइंट. So this point is helps to improve the rotation of the head.
So we know the location of CB22. First, I would like to tell you this movement. We know this movement. So this is the location of CB22 point. We know the throat pit और विशुद्ध चक्र, इसे हम कहते हैं थ्रोट पिट और विशुद्ध चक्र. और देखिए ये जो मूवमेंट कौन सी है, रोटेटिंग द हेड राइट एंड लेफ्ट. The person is not able to rotate the head right and left, maybe because of the cervical spondylosis, because of some other problem. So this is called lateral rotation. We can tell lateral. We are taking the head to the right side. There are multiple group of the muscle involved. We will be discussing them. But right now I'm telling you, you are rotating your neck to the right, then to the left. Sometimes this movement is not possible due to the pain, due to the restriction. CB22, one of the great point, when you are stimulating the CB22, it's working on the root of tongue and on the back side of this hyoid cartilage. CB22 point is working at the very deeper level. जब हम CB22 को दबाते हैं इस पॉइंट को, तो हमारी थायराइड पर भी काम करता है, गर्दन पर भी काम करता है, और हमारे जीभ के रूट पर काम करता है, और हमारी गर्दन की मूवमेंट को ओपन करता है. It's opening the movement of the neck. It's a wonderful point. If the person is not able to move the neck to the right and left, to the right and left. Got it? Is clear? तो ये हमारा था पॉइंट जिसे हम कहते हैं CB20. Now I would like to bring your focus on one more aspect of the CB22. There are two conditions of the spine. Lordosis kyphosis explain करते हैं. आगे स्लाइड है उसकी. Lordosis kyphosis.
तो एक्सटेंड द मिडल स्पाइन. क्या होता है कि हमारा अभी हमारा पोस्चर पुअर पोस्चर था, या स्टैंडिंग और सिटिंग में हम इरेक्ट सिटिंग नहीं करते हैं, तो नॉर्मल कर्व्स हमारे जो स्पाइन के नॉर्मल कर्व्स है उससे वो डिफरेंट हो जाते हैं. ठीक है. तो ये देखिए कि ये जो पिक्चर है सेकंड वाली, वो है हमारी नॉर्मल स्पाइन. पर जब इन पुअर पोस्चर होता है, इम्प्रॉपर बैलेंस होता है हमारे बॉडी में, सो वी आर, तो इन दिस पोस्चर, दिस इज अ Kyphosis and lordosis. These are two conditions which will occur when you have a poor posture. So what do you mean by kyphosis? So kyphosis means it is increase the thoracic spine curvature. So जब पेशेंट का कर्वेचर इंक्रीज होता है थोरासिक स्पाइन का, तो वो कर्वेचर इंक्रीज होगा, तो वो काइफोसिस है. अभी लॉर्डोसिस, लॉर्डोसिस क्या होता है कि हमारी लंबर स्पाइन होती है, तो लंबर स्पाइन का जो भी कर्वेचर है वो इंक्रीज हो जाता है. मेजोरिटी जब लो बैक पेन होता है, तो लो बैक पेन में लॉर्डोसिस स्पाइन ज्यादा होती है. ठीक है, तो लॉर्डोसिस इज अ एबनॉर्मल. जब वो नॉर्मल से ज्यादा अंदर की ओर चला जाए तो वो लॉर्डोसिस एबनॉर्मल है और वो पेन करता है पेशेंट को. तो ये क्यों होता है? क्योंकि इम्प्रॉपर पोस्चर. सो क्लियर एवरीवन व्हाट इज काइफोसिस एंड लॉर्डोसिस? Kyphosis means increase the curvature of the thoracic spine, and the lordosis is the increase the curvature of the lumbar spine.
So we can also see in this image, look at this image here. So we can see here, this person is bending front. This person is bending front, right? The middle person. We have seen many old person. With age, they are keep on bending forward and forward and forward. Have you seen someone? ऐसे कई बुढ़ापे में लोग ऐसे आगे झुक जाते हैं, पूरा फिर डंडे से चलते हैं. Have you seen the person like this? So what is exactly this? This is called kyphosis. Kyphosis. So why it's happening? Because of the spine, curvature is responsible. The curvature of the spine is responsible, and the person keep on bending to the front, and this is happening in the very, very slow process, right? तो जब भी किसी व्यक्ति को काइफोसिस होता है, काइफोसिस का मतलब है कि जब व्यक्ति आगे की ओर झुकता जाता है, कहते हैं बुढ़िया माँ आगे की ओर झुकी, बुढ़िया माँ डंडा लेके चलती. Urinary bladder 11 is the wonderful point for to erect the spine, especially I will tell you what is kyphosis. Kyphosis means when the thoracic vertebra are responsible and the curvature of the thoracic vertebra disturbed. So the person is bending forward. Urinary bladder 11 is extending the thoracic vertebra, UV11. तो अगर हम इस पोस्चर को करेक्ट करना है, you need to stimulate UV11 every day. You can stimulate by the acupressure, you can stimulate by the massage, and you can stimulate by the gua sha, you can stimulate by the needling. Urinary bladder 11 is the point. I will show you the location of this point, UV11 first. It's a very simple point. We already know this, but now we कितने भी उम्र हो, जैसे धीरे धीरे इंप्रूवमेंट मिलता जाएगा, slow and slow, steady improvement. You can see this is the urinary bladder 11 point will be the very good for this condition. We can see here. So this is the location of urinary bladder 11. कहाँ होता है वो भी बात कर लेते हैं. Where it's located. So let's see in this image. I will show you the location of UV11. How many persons are knowing that? I think more than 70% people will be knowing the location of this point. So look at this point, UV11. Below the thoracic one vertebra on the both side, there is the location of UV11. अगर हम thoracic one vertebra की दोनों साइड चले जाते हैं तो हमें UV11 मिलता है. This is the location of UV11. UV11 located 1.5 tune lateral from the thoracic vertebra. हमारे thoracic vertebra से ये 1.5 tune की दूरी पर पाया जाता है. This is the location of urinary bladder 11, right? So you can see in this image, If you see this image, so this is the thoracic vertebra. There is a thoracic bone vertebra. Below that, there is a depression. After finishing the thoracic bone vertebra, we are going 1.5 tune bilateral. We are going 1.5 tune bilateral. We can measure 1.5 tune by the two fingers. So this is the location of urinary bladder 11, and which is the wonderful point for kyphosis and for extending the thoracic spine. Okay. Okay, now there is another condition that is called lordosis.
So the lumbar lordosis, it means the increase the curvature of the lumbar spine. Anteriorly increase the curvature of the lumbar spine is called the lumbar lordosis. So इसमें कमर का भाग अंदर की ओर चला जाता है और इंक्रीज हो जाता है लंबर स्पाइन का कर्वेचर.
तो इसमें आप देख सकते हैं कि अब लॉर्डोसिस का मतलब क्या. लॉर्ड मतलब यू नो व्हाट इज द मीनिंग ऑफ लॉर्ड. कहते हैं कि ज्यादा दादा बन के मत चलो, कहते हैं ना ज्यादा दादागिरी से मत चलो. लॉर्ड का मतलब ऐसा. दिस द लॉर्ड, राइट. लॉर्ड का मतलब. So when the person is moving like this curvature, so suppose I am like this curvature is increasing. I am becoming like this. So lordosis means when the person is छाती दिखा के आगे तान कर चलना. Okay, right. So what is the cause of lordosis? Why? Because lumbar curvature is increasing, so automatically this is happening. This curvature. So when this, because person ऐसे व्यक्ति तो चलेगा नहीं, ऐसे तो चलेगा नहीं, ऐसे तो चलेगा नहीं. तिरछा होके देखो, उसको अपना पोस्चर ऐसे कवर तो करना पड़ेगा ना. Because person has, if the person is curving on the back side, then want to push the body front. So the upper body is pushing front. So it is looking like Lord is walking. छाती दिखा के कोई चल रहा है, इसे कहते हैं lordosis. Wonderful point for lordosis. I will tell you. हमारे पास एक बहुत ही शानदार पॉइंट है lordosis का. So look at here. This is the point for lordosis. That is called CB22, flexion of the spine. ये वो बिंदु है जिसकी बात अभी हमने की थी, throat pit point. So there's a wonderful point. We can do the acupressure every day here, and we can bring the normal flexion of the spine. We can avoid hyperextension of the lumbar spine. हमारी lumbar spine जो ज्यादा कर्व होती जा रही है उसको हम रोक सकते हैं, और हम अपनी स्पाइन को वापस अलाइन करके रख सकते हैं विद द हेल्प ऑफ दिस पॉइंट CB22, right? One of the great point, CB22. So CB22 is the point who is responsible for the flexion of the spine. So we have seen there are 2 points. One point is the back side, UB11, and one point is the front side, CB22. CB22, right? UB11 is the very good point. If the person is bending forward, that is called kyphosis. Good for kyphosis. ये पॉइंट बहुत ही शानदार है. जब व्यक्ति आगे मुड़ रहा, बुढ़िया माँ जैसा। And CB22 is the very good point. When the person is becoming like a lord, means पीछे की तरफ जा रहा है वो, एक तरह से देखेंगे तो he's bending backward to overcome, he's bringing the chest front. So this is good for lordosis. On a single point, with a regular treatment, you can bring the wonderful effect. हम धीरे धीरे करके बहुत ही शानदार इफेक्ट ला सकते हैं. Here I would like to tell you, because we have discussed one point on the back side, one point on the front side. There is another point, who keep your spine in the erect form. आपके स्पाइन को जो सीधा रखने वाला एक दूसरा पॉइंट और भी है, उसकी भी हम बात अभी कर लेते हैं. When we are doing pranayama, when we are doing meditation, we always telling, okay, keep your spine erect. But many persons are not able to do that. प्राणायाम के समय कहते हैं ना कि अपनी रीढ़ की हड्डी को सीधा रखें, अपनी आती जाती सांस को देखें, है ना, रीढ़ की हड्डी को सीधा रखें. But how to keep the spine erect? There is one more point, very wonderful point. Who is keeping your spine erect? That is called urinary bladder 47. Wonderful point, UB47. Remember here, there is a two type of nomenclature. In the one another nomenclature, UB47 is the backs coming at the level of kidney, but we are not talking about that. We are just talking about this point, urinary bladder 47, which is the one of the great point for keeping your spine erect. आपकी स्पाइन को सीधा रखने वाला. और ध्यान रखिएगा कि अस्थमा का कारण क्या है. What is the root cause of asthma? When your spine is not erect, you are bending, lungs are not getting enough space, person is having breathing difficulty. If you go to the chiropractic person will treat your spine even for asthma. By spine is having correction. So urinary bladder 47, but the great point, I will show you the location of this point. Let's see in the other image. If you see this image, if you see this chart, UB 11, 12, 13, 14, 15, 16, 17, 18, 19. Right? We know that 18 is the back-soup point of liver, 19 is the back-soup point of gallbladder, 20 is the back-soup point of spleen, 21 is the back-soup point of stomach. We already know that. हम जानते ही हैं. ये सारे back-soup point है, कोई liver का, कोई gallbladder का, कोई spleen का, कोई stomach का. ये देखिए gallbladder का point है, ये gallbladder का back-soup point है, जिसे हम कहते हैं bladder 90. The bladder 90, the back-soup point of gallbladder. At the same level, we have urinary bladder 48, and upper we have urinary bladder 47. So 47 is exactly, okay, this the 47 is exactly at the level of bladder 18. हमारा 47 नाम का जो पॉइंट है वो कहाँ है? लिवर के बैक्सू पॉइंट के ठीक बगल में है. लिवर के बैक्सू पॉइंट के बगल. इसका मतलब क्या है? इसका मतलब ये है, if you want to keep your spine erect, you have to take the help of liver, because the urinary bladder 80 is the backside point of liver. Just next to that point is also connected with the liver. How the bladder 47 will keep your spine erect? Liver कैसे रखेगा spine को erect? Any idea? अगर आपका लिवर की ऊर्जा सही है तो क्या आपकी स्पाइन सीधी रहेगी? Yes. You know why? Because liver channel is the channel who is from genital to the DU20. I will show you the root. आप बोलेंगे नहीं नहीं ये तो liver 14 पे खत्म हो जाता है. You will tell me ये तो chest में खत्म हो जाता है. No. internal branch of the liver meridian is not ending till the chest. You are talking about the external branch. Liver channel is having connection with the genitals and ending here. Oh, it is ending here on the chest. Then how it will keep the spine erect? Now look at the internal path of the liver meridian. अब ये अंदरूनी पाथ देख रहे हैं. You can see the internal path of the liver meridian. It's reaching till the top of the head, till the D20. तो लिवर एक वो चैनल है जो हमारे सहस्त्रार चक्र पर ओपन होता है. And this is having wonderful capability to keep your spine erect. So we are stimulating. Generally, I do the gua sha here for the patient who is suffering with the misalignment of the spine. So we can do the gua sha here on the location of bladder 47. We can do the acupressure. We can release the motor point. हम असलियत में इस मोटर पॉइंट को रिलीज करना, तो यहाँ पर एक छोटी सी गांठ मिलती है, लंप मिलता है. You might see the lump, you might see the nodule here on this location. You have to release that lump or nodule. You have to release the lump or nodule on the location of bladder 47. As soon as you release that lump or nodule, you will see the energy will start flowing in the central line, and with the time, person will be having erect spine. Right? See, regarding the needling on the CV22, we can needle it. But why you want to needle? Because if you needle deeper, it will touch the aorta. Even I used to needle earlier, but now we have too many points in the body, we can needle them. Because if you are inserting 1.5 needle here, it will touch the aorta. In the aorta, we are having very high pressure of the blood, high pumping of the blood. इसलिए थोड़ा रिस्की है. रिस्की वैसे नहीं है, अगर आपने सही ढंग से लगाया तो कोई रिस्की नहीं. But in this way, I will suggest you just do the acupressure here. That's enough. So we have understood the different way to keep your spine in the perfect position. Let's move ahead. Okay. Now we are moving to the next. That is the, now we are talking about the, we will keep on talking on the different movement of the human body.
So pronate and flex the arm. तो हमने फर्स्ट लेक्चर में पढ़ा था कि व्हाट इज अ प्रोनेशन, व्हाट इज अ फ्लेक्शन ऑफ द आर्म, एल्बो. सो व्हाट डू यू मीन बाय प्रोनेशन? So the pronation and flexion of the arm is done when many people have a problem in the pronation. Also have a problem with the flexion of the elbow. So this is the point which will help to improve the pronation and the flexion.
Okay.
So this is the pronation of the arm. This is the pronation of the arm. Now this is the flexion of the arm. So clear everyone, what is a pronation and what is a flexion?
So pronation means when we are turning the palm downward. जब हम अपने palm को नीचे की तरफ मोड़ते हैं तो इसे pronation कहते हैं. जैसे you are turning your palm downward and tapping your thigh. आप अपने हाथों से अपनी थाई को टैप करिए. तो आपने थाई को टैप करने के लिए क्या किया? अपने हाथों को नीचे मोड़ा. वो हाथों को नीचे मोड़ना ही प्रोनेशन है. Okay. So pronation means donation. When you are giving donation to someone, how you are giving? You are not giving donation like this. You are giving donation like this. That is pronation. Pro. Supination, when you are asking something, give me something. That is supination. Supination means like this. Pronation means like this. Okay. Some person is not able to do pronation. Some person is having difficulty for doing the pronation. One person told me that I am mechanic and every day I do like this. Every day I do that. Some tightening the screw. You can see there are two movements. Number one, this movement. Number two, he's flexing the arm. See, flexion and pronation. Okay. Or we can do the opposite movement like this. This is the supination. So when person is having any difficulty for doing flexion and pronation, we just stimulate one point, that is heart 3, to normalize this movement. एक ही पॉइंट है जिसका हम प्रयोग करते हैं और उस पॉइंट का नाम है हार्ट 3. Heart 3 is the one of the great point who repair your muscle which is involved in this movement. So this is the location of heart 3 here. We can see heart 3 on the medial corner of the elbow. Let's see the location in the other image. हम आपको दूसरी जगह दिखाते हैं. So now we are looking the elbow from the medial side. हम अंदर की तरफ से elbow को देख रहे हैं. We can see the inner elbow crease. That is the exact position of the heart 3 point. So we have to stimulate this heart 3 point. We can do the stimulation. We can do the massage. We have to stimulate this point. If the person is not able to do the flexion and pronation, अगर व्यक्ति फ्लेक्शन और प्रोनेशन करने में असमर्थ है, आप इस बिंदु के माध्यम से उसे करा सकते हैं. Now we are moving to the next movement of the wrist.
Now the extension of the wrist and the abduction of the wrist. So in the picture you can see the what is the flexion and extension of the wrist. So this is the extension of the wrist. When your palm is go upward. Okay, this is the extension of the wrist. And abduction of the wrist means the abduction is also called as the radial deviation. So the thumb side of your palm is go more and more outward. So this is the abduction.
So you can see here, we can also understand this movement like you keep your palm on the table. आप अपना हाथ को टेबल पे रखिए. Keep your palm on the table, right? अपने हाथ को टेबल पे रखिए. रखा ऐसे. Like this. अब बाय बाय करिए. बाय बाय कैसे करोगे? बाय बाय. Bye bye. You are doing this movement. So number one, we are extending the wrist. पहला तो हम wrist को extend कर. फिर हम बाहर की तरफ Y. So when we are taking it outside, it is called abduction. Ab means taking away. So now look at both the palm together. So extension, abduction. So when the person is having any problem, if he is doing like this, he is having some problem. If the person is having some problem, suppose person fall down like this, and it is hyperextended. किसी का बहुत ज्यादा एक्सटेंशन हो गया, आपने किसी ने देखा होगा ऐसे, किसी का हाथ आपने से पकड़ के ऐसे कर दिया, हाइपर एक्सटेंडेड हो गया. When the person is not able to perform these two movements, number one movement, extension, and number 2 movement, abduction. We can just do the held by only single point, that is called large intestine 10. Li 10 located here. We know that. This is the elbow crease. Li 11, from the Li 11, if we are coming to Chunpag distal, this is the location of Li 11. We will release this point Li 11 and we can see the wonderful movement of the wrist. हम wrist की movement को बहुत शानदार देख सकते हैं. Suppose I am doing Namaskar mudra. Okay, Namaskar. This is also the extension of the wrist. आप देखिए. Namaskar. You can see the extension of the wrist. If the person is feeling the pain in this movement, we can make it normal by the Li 10. हम Li 10 के माध्यम से इसे normal कर सकते हैं. Okay, so we can make this movement very easy just by the single point. So this was the one. Number 2, so number 1 this, and number 2 this, abduction, right? So the 2 movement can be done, can be improved by the single point, which is called Li 10. I will show you the location of Li 10. अब पेशेंट हमारे पास किस तरह का है हमें नहीं पता होता, वो किसी भी प्रॉब्लम को लेकर आ सकता है. We should have the idea of each and every movement. We should have the idea of the name of the movement. Then only we'll able to treat the patient. Look at here. So we are looking the Li 10. From the elbow crease, we are going to Jun distal. From the elbow crease, we are going to Jun distal. That is the location of Li 10. This is the Li meridian. And this point is located just at Tuchun. This is the point. Right? So there is a nerve who is going from here, reaching till the wrist. Radial nerve that we know. And radial nerve is responsible for the extension of the wrist. Radial nerve का काम क्या है? हमारे wrist को extend करते हैं radial nerve का. अब देखो यहां से एक nerve जा रहा है. इस nerve का नाम है radial nerve. यहां तक आ रही है. और इसका काम है wrist को extend करना. Suppose radial nerve got injury, then not able to extend, then person will be like this. This is called hand drop, like the foot drop, hand drop. So hand drop is the result of radial nerve palsy. As soon as we put the point on the Li 10, it's improve your radial nerve. ये आपके radial nerve को improve करता है. और अगर radial nerve कट जाए तो व्यक्ति को hand drop हो सकता है. That is called radial nerve palsy. So enough for today. Thank you so much, everyone. Now we'll continue the session tomorrow, because right now my focus to discuss lots of movements, flexion, extension, lateral rotation, medial rotation. So we are also discussing the point. So with the combined study, we will able to understand all the movement in the very easy way. So the session will automatically be uploaded on the website like Joint and Muscle, which is freely uploaded on the course. Maybe within less than an hour, the course will automatically be uploaded there. You can see the recording if you want to revise. Thank you so much. See you tomorrow. Thank you so much, Nidhi. Thank you so much. Let's close the session.